I'm Daniela Miranda. I'm a PhD student at the University of Sevilla. My work revolves around social and community interventions. And right now we have a project that we started last year and it goes on for the next 2 years, revolved around implementing advocacy processes at multiple levels with the Roma community, which is the largest ethnic minority in Spain and in Europe. And they have been characterized of a lot of social marginalization, and their discrimination is manifested in their high unemployment rates in all the social domains. And we take a health perspective when we're doing our work, and that's pretty much it.
Great. Can you tell me a bit about why you decided to implement Photovoice?
Well, I think it's important to say that it wasn't my decision. When we started working with a group of Roma neighbors, we work in a small neighborhood in Sevilla, which is notorious for being a very bad, poor living conditions. And the 20% of the population living there, 25% are Roma neighbors. And so we have a group of 11 neighbors living in the worst parts of that neighborhood, and they're the ones who decided that photo was the best way to manifest their living conditions and to use that as a way to act, use it as a tool for action. And for us as researchers, our objective was to create that collective identity and collective consciousness and make them aware of that their situation wasn't fair, that the inequities that they were living. And they said, you're right, this isn't normal. So we had created a WhatsApp group when we would meet up, and that's how it became a we. And they were the ones who decided to say photos is the best way to take action.
Wonderful. Tell me a bit about the process of how you implemented Photovoice.
We started off by, as I said, we used a WhatsApp group. We had 5 sessions because timing, funding, summer, so many factors that came in that we only had 5 sessions. So instead of using the session times to go and take photos, I think it was important that the first session was starting the dialogue, saying what were health inequities for them, starting to identify what factors in their neighborhoods were affecting their health, not just their physical health, but their mental well-being. And they decided that instead of using the sessions to go take photos, that we would send it throughout the WhatsApp group. And I think it's important because as you're walking from taking your kid to school or going to go buy bread for your groceries for the day, you start opening your eyes and actually seeing things through a different lens, literally. And that a photo is worth 1,000 words. Also, all the cliches, but it works.
Yes. What were some of the most poignant photos?
I think one of, I think it was when the photos of places, I'm trying to think of how you say it in English. How do you say it in English? Like spaces for their free time. I think that's what really resonated with me, because Sevilla is such a beautiful city in our heads, and it is a beautiful city, and the weather and everything just invites you to be outside, and it's such a wonderful place to have community, even if you just meet up for a beer, for a coffee, and you're just having contact and relationship with these people. I think more than the photos was, what the photos said was, we don't have places to go and meet up, and the places that we do have to go and meet up are in these really terrible conditions, and waking up in the morning and seeing that every day is very depressing and causes anxiety. And for them it was, my children can't play here because there's rats because of the trash. And I think it was more than the photos, it was more what was said after the photos. And I think definitely the free time, because and that's where you connect, that's where you feel good, that's where you relate to people, that's where you share your stories, the things that happen throughout the day. And not having that opportunity was doesn't seem fair. It's not fair.
What were some of the outcomes of the Photovoice project?
So the reason we did the photos was because parallel to working with the group of Roma neighbors, we were working with a group of professionals from and different policymakers, different professionals from NGOs, from the healthcare center, from the housing department, and the public cleaning service. So we are working with those two groups parallel, raising awareness on one side with the professionals, and on the other side, creating critical consciousness, doing the photo voice with the neighbors. And one of the most important moments of the project has been sitting those two groups down and creating a space for horizontal dialogue. It was also a very, I don't know what the word would be, maybe humbling for both sides, because they saw each other as humans and not as a service and not as someone who's throwing trash. They just they saw each other in different lights, even though there was a lot of moments of tense discussion because the Roma neighbors presented those photos in that meeting. And that was one of the biggest outcomes to date. And hopefully another outcome that I would like to evaluate is if there has been contact since that meeting, and have they planned other meetings, and have they incorporated this group of Roma neighbors into their policy, program, and planning at the local level.